Who is hiring in the global health space? Where can you apply for a job? Watch this video and find out. Welcome back to this video series on working in global health. My name is Greg Martin. But first, a quick side note. This video has been sponsored by the University of Notre Dame. They offer a Masters of Science in Global Health program, which is absolutely world class. I've taken a look at the program and I've spoken to the faculty, and I must tell you, wow. If you're looking for a master's program that is interdisciplinary, has a strong emphasis on science, and will really and truly give you the skills that'll make you extremely competitive in the global health workspace, then I absolutely recommend the University of Notre Dame's Masters of Science in Global Health. I'll tell you more about the program at the end of the video. You can click on the link in the description if you want to get more information. If you're watching this on YouTube, you can click on the link that's on the screen right now. Toward the end of this video, I'm going to give you a long list of organizations that are working in the global health space. Now, I know what you're thinking. You're thinking, Greg, just give us the list right now. Just relax, slow down, take a seat. You remember that guy in high school. Let's call him Norman. And Norman was so desperate for a girlfriend that he doggedly declared his undying love to every single girl in the class. You kind of had to admire his determination, if for no other reason than as an object lesson in tenacity and steadfast resolution in the face of relentless failure and abject rejection. Now, Norman is still single, and the lesson here is desperation is no substitute for strategy. So the trick is, of course, to take a long list, and that's what I'm going to give you, and to narrow it down to just a handful of organizations that you can really focus on so that you can spend time doing due diligence, spend time networking with key people, and of course, spend time putting together a strong organization-specific application. I'm going to start by talking you through 4 overarching characteristics of organizations that we can use to describe the global health landscape. So all global health organizations can essentially be described in terms of organizational focus, function, type, and location. So the organizational focus is really the problem that the organization is trying to solve, or the issue that the organization is interested in. And I've divided these areas of organizational focus into 5 domains. So the organization might be focused on diseases of interest like HIV, TB, malaria, exposures of interest like tobacco, alcohol, high caloric diets, population groups of interest like maternal and child health, people living in poverty, displaced people, disciplines of interest like health policy, health economics, epidemiology, demography, etc. Special issues, and here we're talking about issues like gender, equity and human rights, climate change and health, pandemic preparedness, trade and health, port health, e-health, technology and health, and many, many more. Suffice to say that most organizations have an area of focus that really is a combination of the 5 domains. The next thing that we need to look at is how the organizations achieve their strategic objectives. These are the functional areas that they work within, and they include funding, which is providing finance to implementing partners, research, which is done mostly but not exclusively by universities, advocacy, which is lobbying for specific change or representing the interest groups of specific and they're usually disenfranchised population groups, governance, which is really about establishing and safeguarding accountability, product development, which is done mostly but not exclusively by the private sector, health system strengthening, which is about capacity and capabilities within national health programs. And you'll often hear about the 6 building blocks of health systems, and I'll just briefly go through them. They are leadership and policy formation, healthcare finance, human resources for health, procurement and supply chain management for products for health, information and communication technology for health, and service delivery. So we've looked at what organizations are focused on, and we've talked about their function, how it is that they work to achieve their objectives. Next, we want to have a look at the various types of organizations that are out there, and these include supranational or transnational organizations. These are like UN agencies that don't fall under the jurisdiction of any particular country. Then there are national structures, and these are usually tax-funded agencies or government departments, either focused on providing support to other countries or responsible for domestic health services. And then we've got NGOs, the private sector, and public-private partnerships, and any of these can fall into global, national, or local jurisdictions. And finally, we're going to talk about location, where the organization is physically located. This is important because you need to be thinking about where it is that you want to be physically located. So what is the practical application of this framework? Well, the first thing to take note of is that global health is vast. Saying that you're interested in global health is like saying that you're interested in sport or saying that you like food. It's too broad. Now watch the first video in this series if you're struggling to identify your specific areas of interest within the global health space. When you've got a sense of what it is that you're interested in, and by all means have more than one interest, you can use this framework to do a stakeholder analysis or a landscape analysis of that particular area. Because believe me, for almost every area, there are a large number of organizations in each of the functional areas and each of the organizational types and working at the global, national, and local levels. So let's use an easy example to walk through the framework. We'll take HIV and we'll start with funding. So for funding, we've got the Global Fund, we've got the Gates Foundation, we've got PEPFAR, we've got UNITAID, and many, many, many others. Research, that's just about any university, LSHTM, Johns Hopkins, Notre Dame, the list goes on and on. Advocacy, we've got AIDS United, we've got the AIDS Vaccine Advocacy Coalition, we've got Oxfam, we've got MSF. Governance, there's UNAIDS, there's WHO, and of course there's the national programs themselves. Product development and access, of course there's Big Pharma, but there's also interesting work being done by the Medicines Patent Pool to facilitate voluntary licensing. There's the WHO pre-qualification program to ensure that drugs are safe and effective. And of course UNITAID is working hard to bring down the prices of drugs. Health system strengthening. CHI, or the Clinton Health Access Initiative, is a good example of an organization working with national programs across a number of health systems areas. And in terms of organizational type, we've got our supranational or transnational organizations. So there's the WHO, there's the World Bank, there's UNICEF, there's UNAIDS, there's UNITAID. National programs like DFID, acting as a bilateral funding agency, and of course all of the national programs in the countries affected by HIV. NGOs, again, we've got CHI, we've got EGPAF, we've got Mothers to Mothers, we've got MSF, we've got Oxfam. Private sector, again, we've got Big Pharma, but don't forget to think about consulting companies like McKinsey, Boston Consulting, Rabin Martin, and others. And of course, public-private partnerships, a good example is Gavi. For location, we've got global, obviously the WHO, we've got national, like the CDC, and for local, we've got organizations like EGPAF or MSF. They've got global reach, but they also have local and subnational presence. The point here is that if you take any area of interest, you can use this framework to do a landscape analysis or a stakeholder analysis, and that's going to help you isolate the handful of organizations that you need to start researching in detail and you need to start networking with. Now, if you found what I've just gone through a little bit intimidating and overwhelming, don't panic, I'm here to help. Depending on when you're watching this, I've either already published or will shortly be publishing a book that maps out the global health organizations against this framework. And I'm also going to provide a lot more detail and useful information about each organization. So you can either order the book now if you're watching this at some point in the future when the book's actually being published, or you can sign up for an email alert that will be sent to you when the book is ready. You can find more information in the description below this video. Right, it's time to give you that list of organizations that you've been so patiently waiting for. If you're listening to this as a podcast, then look for the link in the description of the podcast below, and that'll take you to the YouTube video where you'll be able to see the list. And now, as promised, I'm going to tell you a little bit more about the Masters of Science in Global Health program that's been offered by the University of Notre Dame. Joining me now is Catherine Taylor. She's the director of the University of Notre Dame's Master of Science in Global Health program. Hi, Dr. Taylor.
Hi, Dr. Martin. Thanks for speaking with me. I think that your video is going to be very helpful to individuals looking to join the global health workforce.
Dr. Taylor, I wonder if you could just tell us a little bit about Notre Dame's unique position in the field of global health education.
Certainly. We have two main pillars in our program. The first pillar is the how and the why do we do what we do. And this has to do with an emphasis on the importance of equitable partnerships on issues of social justice and compassion, and the importance of humility on the part of the global health worker. The second pillar has to do with what we do, the technical skills and the knowledge that the global health workforce needs. And ours is a science-centric program, and that really does make us unique. And we focus on developing the research skills in our students, and they have a really great platform in analytical skills, which is very attractive to global health employers.
Absolutely. And I wonder if you could tell us a little bit about what it is that the university does to prepare students for their life in the workforce in the global health space.
We also include a large amount of professional development in our program. Our students have access to our graduate school, which provides them one-on-one help with their CVs, with their LinkedIn sites, and other things like that. But Notre Dame is special in that we have an extensive alumni network and an extensive network that works in the global health field and our global health leaders. We put our students and our graduates in direct contact with these leaders. They both learn from them, they're inspired from them, and they become an immediate part of an expanded global health professional network for them.
Dr. Taylor, I wonder if you could tell us a little bit about what it is that your students tend to do after graduation.
We're very proud of the types of positions our students are getting. They're working both domestically and internationally. They're working for large non-governmental organizations such as Catholic Relief Services, Partners in Health, and CARE. We have students that have gone to the smaller non-governmental organizations such as TIMI Global Health. They're working at other universities. 2 of our graduates this year went to the Harvard Global Surgery Group. They're working in industry, Centers for Disease Control, offices of public health across the country. We also have some graduates that are going on for further training in medicine, nursing, and PhD programs.
Well, I, for one, am extremely impressed with your program. Thanks very much for coming on the show and telling us about it.
Thank you, Greg. My pleasure.
Thank you for watching this video. Subscribe to the YouTube channel if you haven't already. Please support the channel at Patreon, and if you do, you'll get access to additional content that I create specifically for people that support the channel. Until next time, take care.